Yeah, I've been amazed at how much the community cares about what NMC brings.
Fundamentally, it's about our people and our community. It's about our staff, our volunteers, our medical staff, and the people that entrust their care to us in Franklin and Grand Isle counties.
It's creating that relationship with our community. You can hear it in the feedback that we get from patients about the quality of care that they get here.
I'm absolutely extremely passionate about this hospital and this community and having a vision of wellness. What's most important, it isn't my vision. I get the staff involved, I get the medical staff involved, I get the community involved, and what do you think is important? What are the needs of this community? What are the needs of the staff? And then how do we bring that together for a collective vision?
I think there's a really strong, unique support for this institution and the staff, the leadership, the healthcare providers that feels unique.
We're so lucky to be in a small community like this and so many active people.
When you see the big blue H on the road signs, it typically stands for a hospital. We want it to stand for the center of health, that this campus is a catalyst to wellness and prevention.
It's a small community, and we keep track of each other. I still see people on the street from both places. Just the other day, somebody said, "Kathleen, you helped deliver this baby, and here's my granddaughter. This is she." You know, does that make you feel old? But people remember you.
The history of this hospital is very fascinating when you think about how it got started and then how the second hospital location got built, and really built with money of passion and gratitude about what the care is like in this community. And I think it talks a lot about the strength of this community and the will to come together for one vision and one mission.
I think we've all shared that commitment to local health care, that this community will always be cared for. We're part of the community fabric, and I think we'll always need health care. It will evolve and change how we deliver it, what the technology is, what the population base needs for mixtures of specialists. But we've been here since 1883. As St. Albans came together as the population center in Franklin County, Chauncey Warner bequeathed assets to the community to create the first St. Albans Hospital. In 1947, you've got Jeannie Curbs. Local physicians saved her son.
When her son was shot down at Camp Killcare, she was extremely grateful for the services of Dr. Semple, who basically saved his life, and so she wanted to do the right thing.
And Curbs Hospital was born. In one of the interesting twists of history, the St. Albans Hospital stayed.
So you have to imagine we had two medical staffs, one at each end of the street, and not all docs belonged to both of them.
And along with the separation of the physical facilities, you had a political split in not only the city of St. Albans, but in Franklin County.
Yeah, you really don't need two hospitals in a community of this size. It was inevitable that there should be a union. I think a lot of the issue is, well, where should it be?
It was a rather difficult time. Emotionally, people hung on to, the St. Albans Hospital was the original hospital. I was born there, and many people who worked there and were associated with it just didn't want to give it up.
Most people in time realized that one location, one site made sense, and it's fair to say common sense eventually prevailed.
And I think there was a lot of great feeling that we had come that far.
As a community, it ended up really healing a lot of wounds. And instead of having something that was weak and divided, you have something that's unified and powerful.
Fast forwarding to today, those partnerships continue to be nurtured. When you think about healthcare reform and how the environment for healthcare is changing, we need to come together.
When I go around the state, people look at Northwestern as a major hospital and a leader.
We're a huge resource from an economic standpoint for the community.
Northwestern has really established itself as a premier hospital.
Northwestern, in a very challenging healthcare environment nationwide, has continued to be able to provide its mission, providing care to the community of Franklin County, Northwestern Vermont, and be able to do it successfully. And that can't be said everywhere.
When you think of the NMC campus as being somewhat of a hub in our community, there's a lot of spokes that go out that are really, really important.
And they've been proactive, and I think the community has benefited from is for them to go out there and ask, what can we do as the hospital for our community?
It's been a long association with the hospital. NMC does the credentialing for new hires for us. We send our bloods to the lab here. The ER has access to our medical records. Actually, we've compiled a list 4 pages long of the things that we do together.
We're very fortunate to have a small community hospital here. There's a different experience in that hospital. People going out of their way.
My wife got sick a few years ago, and the care that she received exceeded my expectations.
It doesn't matter what part of the organization you belong to, everybody's an equal part.
Walking through the front door and being greeted by a concierge and everyone you meet in the hallway that smiles and says hi to you really makes a difference.
This is an organization that is nimble, it's friendly, it's forward-thinking, and it is a gem in this community.
Where other small hospitals are talking about layoffs or fearful of what's next, this hospital looks to the future and how we can build it better for our community.
I think it's important for the community to support this capital campaign because we're just looking to provide better care. There's only so much you can get out of an older hospital.
You know, we have not had any major renovations to this or building project to this campus in quite some time. The state of Vermont is changing very quickly. We're trying to anticipate all of that as part of what we're planning and best position the organization for those changes.
The purpose of this campus redesign is really about improved workflow and improved access to care and timely care, providing high quality, low cost, and a patient experience. A centerpiece of this project is the opportunity to bring specialists to the campus.
By integrating an entire campus, including not just the inpatient hospital work, but also the clinical practice surrounding it, it creates a great deal of efficiency. Those efficiencies absolutely improve the quality of the care and the ease of access of care.
That patients that come here for inpatient care are in private rooms because of the changes, the technology, the importance for family to be part of a patient's care. We think about the Center for Health and folks coming to this campus as a destination. So when they're not only coming here to get a treatment, but they're thinking about what things they can do to improve their own health.
So patients can come to the campus and receive whatever medical care they have, whatever wellness programs they're involved in, and ultimately inpatient care and surgeries as needed, all on one campus.
The legacy is simply put, I think, is to provide that exceptional care for every individual and to make sure that there is a strong healthcare delivery system that this community can count on for the many years to come by the decisions that we're making today.
It's all part of what you have to do to best be able to take care of the guy who walks in because he's afraid because he has pain in his chest in the manner that you would like your father or husband to be taken care of there in that situation. It's about people.
What makes me smile at the end of the day is the incredible team that I'm working with. They believe in the mission of this organization and they take great pride to bring it alive every single day.